So in addition to adding as many providers, high quality providers as possible in all of our networks, we've recognized that there's a limit to how many just physical brick and mortar providers are available. So to that end, we've really been purposeful in curating a virtual network in addition that lays within our normal networks available to everyone of behavioral health providers that are virtual or a combination. These providers are typically available either nationwide or in multiple different states and have rapid access to the care that you need. So we know that we hear anecdotally people may call to make an appointment in person, and that appointment may be weeks to months out. But with our virtual providers, we know that you can get an appointment typically within about 48 hours, but almost always within 7 days. And again, as we've been thinking about what are some of the needs in the network, we want to make sure to have providers for general behavioral health, treating common conditions, anxiety, depression, adjustment disorders, but then also getting a little bit more nuanced and specialized, thinking about some of the trickier to treat conditions, children's needs, teens and adolescents. We have specialty providers that address needs of LGBTQ populations. We also have specialty providers looking very specifically at substance abuse and using a variety of different philosophies and methods to be most effective, especially with substance abuse as a really tricky challenge. One of the other things that we've also tried to do is make sure to have high acuity providers in this virtual network as well, so that the people you're seeing online can also prescribe medications for you. And if you need to have more intensive therapy, that's also something that can be administered virtually. One other important factor about our virtual behavioral health providers is really wanting to be equitable in terms of bringing the access out into communities that traditionally have been left out. And especially thinking about our broad state of Washington, we have so many diverse climates. We have regional changes in weather and mountains that can make long travel difficult. And it's really important, especially for behavioral health, to add in that convenience factor and remove the barrier of a long distance for transportation. So again, not everyone will prefer the virtual method, but I do think that having that option provides that needed access into some of the corners where it's been lacking.